Can Mounjaro cause high ferritin levels in blood tests? If you've noticed raised ferritin levels on a blood test whilst taking Mounjaro, you might be wondering whether the medication is to blame. Let's look at what the evidence actually shows and what might be going on. First, some context. Mounjaro, or tirzepatide, is an injectable medication licensed in the UK for type 2 diabetes and weight management. It works as a dual hormone receptor agonist, helping to control blood sugar and reduce appetite. Ferritin is a protein that stores iron in your body, mainly in your liver, spleen, and bone marrow. Doctors measure it to check your iron stores and assess overall health. Here's the important bit. Clinical trials and UK regulatory data show no established link between Mounjaro and raised ferritin levels. The medication itself doesn't directly cause high ferritin. But here's what's actually happening. Many people prescribed Mounjaro have underlying health conditions that can independently raise ferritin levels. These include metabolic syndrome, obesity, non-alcoholic fatty liver disease, or chronic inflammation. Ferritin isn't just an iron marker, it's also an inflammatory marker, which means it rises when there's inflammation in the body. So if your ferritin is elevated whilst you're taking Mounjaro, it's more likely reflecting these underlying metabolic conditions rather than being caused by the medication itself. Think of it this way, the same health issues that led to your Mounjaro prescription may also be contributing to raised ferritin. Several conditions can cause elevated ferritin in people taking Mounjaro. Metabolic syndrome, which includes insulin resistance, high blood pressure, and abnormal cholesterol levels, often comes with chronic low-grade inflammation that raises ferritin. Non-alcoholic fatty liver disease is particularly common in people with obesity or type 2 diabetes, and it can significantly elevate ferritin levels. Other causes include hemochromatosis, which is a genetic condition causing iron overload, hepatic dysfunction, or other sources of chronic inflammation in the body. If you've had a blood test showing raised ferritin, it's important to have a proper conversation with your healthcare professional. They'll want to investigate the underlying cause rather than simply stopping your Mounjaro. Your doctor might arrange further tests, including fasting transferrin saturation, which helps distinguish between true iron overload and inflammation. They may also check liver function tests, inflammatory markers, and conduct a clinical assessment of your overall health. The key is identifying what's actually causing the elevated ferritin. In many cases, it's related to the metabolic conditions being treated rather than the treatment itself. And your healthcare professional can determine whether your Mounjaro should be continued, which in most cases it can be, whilst addressing the underlying cause of the raised ferritin. You should seek medical advice if you discover elevated ferritin levels on routine blood tests. Your doctor will need to assess whether specialist referral is appropriate, particularly if your ferritin is very high or if your transferrin saturation is significantly elevated. Don't stop taking Mounjaro without discussing it with your healthcare professional first. The medication may be providing important benefits for your diabetes or weight management, and stopping it abruptly could affect your overall health. Our management typically focuses on treating the underlying condition whilst continuing Mounjaro if clinically appropriate. If you have fatty liver disease, for example, improving your metabolic health and liver health may help your ferritin levels over time. Your clinician can advise on the best approach for your individual situation. If inflammation is the issue, addressing the source of that inflammation becomes the priority. For true iron overload conditions, your doctor might refer you to a specialist for specific management. If you experience any side effects whilst taking Mounjaro, you can report them through the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. This helps regulators monitor the safety of medicines. Remember, always consult your healthcare professional for advice tailored to your individual situation. What works for one person may not be appropriate for another, and your doctor needs to consider your complete medical picture. So to recap, Mounjaro doesn't directly cause high ferritin. Elevated ferritin in people taking Mounjaro usually reflects underlying metabolic conditions, inflammation, or liver issues. Proper investigation with your doctor is essential to identify and treat the actual cause. Have you had questions about blood test results whilst on medication? Drop a comment below. And if you found this helpful, please like and subscribe for more evidence-based health information from Bolt Pharmacy.